Under very unusual circumstances, Ontario delivered its mini budget today, dealing primarily with how it's going to deal with COVID-19. And I have the architect of that budget joining me from Queen's Park, Finance Minister Rod Phillips. Thank you very much for joining us.
Thank you for having me, Cynthia.
Now, normally on Budget Day, Finance Minister, there's it's a sense of euphoria. It's an achievement for a government, and in particular the Finance Minister. But this one must feel very differently for you today.
You know, these are extraordinary times, but you're right. It feels different for me, and I think different for all of us. Around Queen's Park, we normally have a pretty good crowd on Budget Day, but not today. And of course, we don't want to have a crowd anywhere. COVID-19 is the biggest challenge that we've faced, whether it's health or economics, certainly in my lifetime. And it's so important that we all take it seriously, and that's what our government made sure we did today. $17 billion to support people, to support our healthcare system, to support our businesses. We know that a lot of people are struggling with this challenge, and we want to make sure that they know that the government is here to support them. We're going to get through this, but we're going to have to get through it by working together.
Now, we are going to end up with the deficit being doubled, which, coming from a government that has tried so hard to curb that deficit, was that a difficult decision? It's now going to be $20.5 billion in your projections.
Cynthia, it really wasn't. I mean, we were in a position because of the hard work we'd done, because we'd put Ontario back on a sound financial footing. We were in a position to make the right decision. But truthfully, it wasn't that tough a call. When it comes to the health and safety of Ontarians, that has to be paramount. And when it comes to jobs and the economy, that has to be most important. So for now, we're going to have this larger deficit. We're going to make sure we put the resources in place, particularly for our healthcare system, but also for people and for businesses, to make sure that we get through this together.
Now, let me ask you about the increased funding to healthcare. It's $3.3 billion. But just a year ago, the financial watchdog, budgetary watchdog, warned that Ontario actually needed to put in $7 billion over 3 years to just maintain the current standard of care because of the aging population, the growing population. So in essence, that's $2.3 billion a year. You're putting in $3.3 billion this year. Is that enough to keep the system going and fight the pandemic at the same time?
Well, we listened to our healthcare stakeholders. We listened to frontline workers, whether it was nurses or doctors or the pharmacists. And of course, we listened to our Minister of Health, Christine Elliott, who's been doing a great job leading this initiative. And we gave them the money that they asked for. It's 4.8% increase, over $900 million for hospitals this year, $343 million for 1,000 more acute care beds and 500 more severe beds, as well as funding for 70 more COVID-19 treatment centers, testing centers. So, we've listened, and then in addition, as you know, we put $1 billion contingency, a COVID-19 contingency. So we know that healthcare and having good hospital system, having our frontline workers have the support they need is what Ontarians expect of us, and that's what we're doing.
And Minister, I know you put in a bit of a rosier end to next year, saying that things could improve. How long do you think, once the COVID virus is completely quelled, how long do you think it would take for the province to recover economically?
Well, it is very hard to say. As your viewers know, any economic downturn usually is a matter of confidence. But this one is unique because it's based on concerns about a health issue, a very severe health issue, a global pandemic. So we're taking all the steps, whether it was declaring essential services or closing the schools, as we were the first to do in the industrialized world, taking all the steps we can to minimize the spread of COVID-19. But quite frankly, Sylvia, nobody knows exactly when that pandemic will end. What we have done is make sure the resources that we have will be the resources we need to get through it. And then, we are hopeful. There's a lot of resilience in the Ontario economy, Ontario spirit, as the Premier calls it. We're very confident that once we turn this corner, once we get past the health issue, that the Ontario economy will come back strong. It was strong before and will be strong again. But for now, we've got to support our healthcare workers. We've got to support people who are losing their jobs. We've got to support our companies so they can keep people employed.
Minister Phillips, thank you very much for joining us. I do appreciate your time, and hopefully one day soon I'll be able to interview you again in person.
I'll look forward to that, Cynthia. Stay healthy.